with that, we move forward with Wing Commander MK Bose, CEO, Amor Group Hospital. A distinguished healthcare executive, Wing Commander MK Bose brings exceptional leadership and strategic vision, driving excellence in hospital management and patient-centered healthcare delivery. I request Wing Commander MK Bose to kindly come up to the stage.
Good morning, distinguished guests, honored doctors, delegates, friends from the media, the healthcare workers. A very good afternoon to all of you. At the outset, I must extend my appreciation, thanks and gratitude for the invitation that was extended to me by the organizing committee for having given me the opportunity and the platform to speak my mind out on a subject that I have very close to in my heart. Unfortunately, the young lady has already given me a time frame of just 10 minutes, so I'll be running against time, so pardon me if I miss out something. It's a subject that has been long enduring. It's a subject that has been in my heart for a very long time. And my talk today will not only be the highlight, the importance of artificial intelligence, trying to modernize the rural healthcare, but it will also highlight the gaps that are existing in the rural healthcare, and because of which the uniformity of the healthcare across the country is missing. We all talk about the modernization, we all talk about the advancement that the healthcare has made today, but we forget that the healthcare has not been translated across the country. And that is my endeavor today, to bring out that gap and also how artificial intelligence is going to bridge that gap and modernize the healthcare for the benefit of one and all, and especially the rural healthcare. Now, before I proceed, I would like to get you a glimpse of what actually happens in the rural health setup. Think about a pregnant mother who travels 4 hours in a rural health setup to just get an antenatal checkup done. Think about an ASHA worker who travels from village to village trying to do her very best in delivering healthcare, but lacks the resources that one needs to have. Think about that young doctor in a primary healthcare center who's trying and striving to do best, but is lacking the resources of a specialist services. Think about the cancer patient whose diagnosis, if it would have happened a few hours or a few months earlier, would have been able to save his life. That is the reality of the rural healthcare. Now I'll take you to another scenario. Think about a 58-year-old patient in a village, develops severe chest pain. The family rushes to him. They try to get across to another hospital which is 100 kilometers away. They try to look for transportation which is missing. We lose a life. That is the reality again in rural healthcare. Now imagine another reality. The same patient had been seen by an artificial intelligence process and system, and they would have detected much earlier about his onset of the cardiovascular problem that he would have had, and we would have been able to save a life. Now imagine a village health worker who would have been equipped with an artificial intelligence system in his hand, by which he would have gone around from family to family and given them the advancement and the advance notice by detecting any kind of a symptoms that they would have had, and we would have again saved lives. For over a century, we have taken patients to the hospitals, but the time has now come that we take healthcare to the patient, and that is where artificial intelligence steps in. That is the future I'm talking about. That is the future we should all look forward to. A future where artificial intelligence mixed with human compassion and a system will take healthcare to a different level, and it will be uniform across the country, and not just the people staying in the urban area, but also the people staying in the rural care will be benefited. Why I am so passionate about having the healthcare system spread across the country is because by benefiting only 37% of population which stays in the cities being benefited, we all see the glitz and glamour and the beautiful buildings, but we don't understand that the ramshackle building from which the rural people get their services. It is that division, it is that divide we need to bridge. And unless and until we do that, India will never make a progress. 63% of our population are still deprived of that simple little healthcare that they require on a day-to-day basis. Talking about India has made a remarkable progress in healthcare, yet significant disparities still remain between the urban and the rural health population. Specialists are only confined to the cities. Specialist diagnosis are confined to the cities. They are all deprived from in the rural health setup. India today stands at a very interesting intersection. Our digital capabilities are advancing, yet the realities on the ground, especially in the rural areas, are far from reality, and we still have a lot of distance to travel before we reach out to those rural people. On the ground, the divide between rural and the urban is not abstract, it is deeply human. And the divide is because of the lack of continuity, lack of dignity of care, and the lack of dignity of healthcare services. These are the differences that is existing between urban and rural healthcare. The difference is just not about rural and urban. The difference is between the reality is between the divide is deeper. The deeper issue is the abstract. The deeper issue is to understand what they need, and the deeper issue is to understand and appreciate and do something for those rural people staying in our country. The real divide on the ground manifests into delayed diagnosis, avoidable complications, and a constant compromise on the quality of care. They have distance to travel. They have difficult choices to make. Difficult choices means I'm talking about the affordability part. Many of them do away with the choices by giving away because they have no affordability to take care of their families. So that is the difficult choice that they have to make at times. Difficult choice in terms of affordability is that the need for a medical care is given up only because they can't afford it. This is where artificial intelligence again can bridge that gap. The divide is not merely rural versus urban. It is reliable versus unreliable healthcare. Until now, the divide is not only we have to be consistent, we have to be connected, and we have to be close to the patient if we have to serve the rural healthcare population. The divide is not merely geographical. The divide is also existing economical, educational, and digital. Most importantly, it is a divide of opportunity. It is a divide of affordability and accessibility and availability. The deeper challenge confronting rural healthcare is not merely one of scarcity, it is of fragmentation. For decades, we have attempted to bridge that gap by creating an infrastructure, by constructing buildings, by making beautiful hospitals. But the time has now come that we have to come out of these buildings. The clinicians, the healthcare providers have to come out of these four walls and reach out to the patient in the rural healthcare. And how do we do that? It is only through an artificial intelligence. Many of them people think that artificial intelligence is going to take over from the clinicians. I don't think so. Artificial intelligence is not come here to replace the clinicians. They have actually come to assist the clinicians. It is going to empower the clinicians. It is going to empower the nurses. It is going to empower the technicians. It is going to empower the pharmacists. It is going to empower the healthcare workers. That is what artificial intelligence is all about. It is disruptive, but not so much as everybody thinks about. There is a lot of gap in the understanding of artificial intelligence, and that's why there is a fear which is playing into the minds of people that artificial intelligence today is going to replace the human. It is not going to do so. It will help deliver safer, more informed care and extend the reach of every skilled clinician beyond the walls of the hospital that they are in. AI allows expertise to travel where specialties cannot reach, where specialists cannot reach. It allows knowledge to reach where excellence cannot, where infrastructure has not yet arrived. That is what artificial intelligence is going to do. It enables every district hospital, every primary health center, and every community health worker to become a part of a larger, intelligent ecosystem. They'll become a group. And for that, we need to empower the healthcare workers at the last mile, We have to empower the ASHA workers. We have to empower the lab technicians through these artificial intelligence. Unless and until we empower them, we'll not be able to deliver the healthcare that we are looking forward to deliver. A village health worker armed with an AI-assisted diagnostic platform can identify high-risk pregnancies earlier. A chest X-ray can be diagnosed much earlier and the patient can be forewarned and preventive measures can be taken. Diabetic retinopathy, oral cancers, tuberculosis, cervical cancer, cardiovascular risk can be detected earlier. That is the power of artificial intelligence. AI replaces clinicians? No. But it helps prioritize attention where it is most needed. The real power of AI lies not in automation, but in the amplification. It amplifies the capability of the healthcare workers. It amplifies the capability of the nursing staff. It amplifies the capability of an ASHA worker. Artificial intelligence should not make healthcare more technological. It should make healthcare more human. That is what we should perceive artificial intelligence as. It goes beyond doubt that hospitals are among the society's greatest institutions. They represent healing hope, expertise and innovation. But healthcare cannot remain confined within those four walls. The challenge is to extend the reach of the healthcare to those rural setup through the means of artificial intelligence. Healthcare must become accessible, continuous, predictive and preventive. The future of healthcare will not be defined by how many beds we build. It will be defined by how many lives we save. So hospitals alone cannot do that service. Buildings do not heal people. People heal people. And people are enabled by the system, the artificial system. And most importantly, it is the leadership which enables these systems to be built. And how we build depends on us. The artificial intelligence itself is a great equalizer. It has often been portrayed as a disruptive technology, as I have often said. Yeah, I see it differently. I see AI as one of the greatest opportunities to democratize healthcare. AI has the potential to bring world-class facilities right on the doorstep of a villager staying in the last house of a village in a rural setup. It transforms healthcare from being location-dependent to knowledge-dependent. This shift is revolutionary. A village should not be deprived of an expertise just because the specialist is not available, just because a healthcare specialist is not available, just because a clinician is not available. AI can bridge that gap. Artificial intelligence will not replace the human heart of medicine. It will extend its reach. The future of rural healthcare belongs not to those who build the most hospitals. The future belongs to those who saves the maximum amount of lives. AI is the most important in early detection of any kind of a disease or symptoms. That is why AI is so important to us today. One of the greatest opportunity AI is that of making an early detection. Imagine screening an entire population of diabetes. As somebody said that India is the capital of diabetes. Yes, I agree. But why it is so? Because we are not able to still do early detection. Artificial intelligence can help do that, especially in a rural setup. Cardiovascular problems can be detected earlier. Cancer can be detected earlier. All of these detections not only saves complications, but saves great amount of hospitalization, great amount of expenses. And these saved expenses can go a long way in a rural health setup. You would be surprised to know that 31% of our population in India goes below poverty line every year just because they have to make out-of-pocket expenses. And that is a huge, huge block for us in a developing country like ours. AI systems can analyze large volume of data. In a recent meeting, I had to come to know that antimicrobial resistance drugs are being prepared through the help of AI. Why? Because AI has the capability to analyze large amount of data in a very short period of time. I'm not saying humans cannot do it. They can. But AI has the capability to not only do it at a very, very rapid time, but it also sees microly as to what are the differences in each of these data. And that is why it can analyze those data very well, and it can give you a very good prediction for you to go ahead and produce those drugs which will help you in antimicrobial resistance. AMR is a very big challenge for the clinicians today. Multi-drug resistance has become very common in most of the ICUs, and we are trying to cope up with it. AI can do, but at the same time, we have to ensure that AI is not fed with data which is not audited, which is not authentic. AI will only do that what it can do, what is being fed with. The analysis of data depends upon what is the kind of data you are feeding to the artificial intelligence, to the system. AI has tremendous amount of potential, but it also has risk. It is not neutral, because after all, I still believe that it is the man behind the machine that matters most. Unless and until we feed data which is authentic, which is large, which is substantive, the results that come out from the artificial intelligence will not be correct, and we have to be careful against that. So for that, we need to have data to be audited periodically so that it can give us the right amount of prediction and the detection can be foolproof. I once again say that AI can only happen in these rural setups only when we take a careful measure of training and educating the last mile, that is those healthcare workers, because it is those people who are going to deal with these rural health workers. And here comes a very important point, that the rural health people, those rural people in the rural setup mostly depend on trust. The trust is on the human that is sitting behind that machine. They don't trust the machine, they trust the human. Because in a rural setup, trust is not substantial or transactional, it is relational. They trust the human which is sitting behind those systems. So we have to ensure that what those people sitting behind the machine is well educated, well aware, and well trained. And secondly, in the rural setup, we also have to ensure that those people who come to those people, the health workers, are empowered. They develop those kind of trust, so that what they do, what they give out, their data is secure, they feel informed, they feel respected. Only then they can trust. Because unless and until they develop trust in the system through those people who are delivering healthcare to them, we will not be able to achieve what we have set out to achieve. The last and most importantly is the ethical. We have to be absolutely ethical in our dealings in artificial intelligence. Unless and until we are ethical, we will be heading in a wrong way. That if we are not ethical, we go in an unethical way, we try to speed up things without being absolutely correct in our dealings with the developing of artificial intelligence, will be deepening and widening the gap between the rural and urban setup far more than what we expect. We'll develop the inequalities and deepen the inequalities far more if we are not careful and being ethical with them. So let us imagine a scenario in an AI implementation. In this case, if we see that the AI has been developed, it has reached the last mile, the rural health setup, it can do wonders for in our Indian healthcare setup. Now, for all of this, the most important thing how we can do is, a lot matters on the leadership. The transformation we seek cannot be achieved by one stakeholder alone. Government has to take responsibilities, the hospitals have to take responsibilities, the clinicians have to take responsibilities, the technology companies have to take responsibilities, the academic institutions have to make and prepare future healthcare professionals in the most ethical way. The healthcare leaders must challenge the conventional thinking and embrace new possibilities. Only then these changes can happen. We often speak of artificial intelligence as the frontier in healthcare. I believe history may judge it differently. It will see that we have developed a system which is ethical, which is trustworthy, and reaches to the farthest corner of this country and heals the people who who are the deprived ones, who are the most differentiated ones, and who are the ones who have been away from the modern healthcare as they should have been delivered to. So before I conclude, I would like to emphasize that the success of AI will depend on the 5 factors. Create digital infrastructure with purpose, empower the frontline workforce, make conventional intelligent and prevention intelligent, build trust through ethical AI, and measure success by health outcomes. Just by instituting and implementing all this artificial intelligence in the rural health setup will not work. Plenty of companies are coming forward and instituting just because the government has given them a mandate. But what we are missing out is we are not looking at the outcomes. So all of these deliverables, all of these institutes which are being putting up these artificial intelligence systems in the villages as per the Ayushman Bharat digital mission, we are not dealing with them on the outcome measures. So outcome measures has to be the most important factor when we institute these artificial intelligence systems in the rural setup. Finally, I'm running short of time, so I'll say that finally to conclude, I have the following to state. The true measure of healthcare system is not how advanced it is in its largest cities, but the true measure is how effectively it serves the most remotest villages of this country. Artificial intelligence provides with a historic opportunity and the opportunity to reduce disparities, an opportunity to improve outcomes, an opportunity to make healthcare more accessible, affordable, and the important thing is it should be equitable. But technology alone will not transfer and transform healthcare. People will, vision will, leadership will, compassion will. If we combine the power of artificial intelligence with the wisdom of human judgment and the compassion of caregivers, we can create a future where quality healthcare is available to every individual, regardless of the geography that they are located at. For over a century, we have taken patients to the hospital. The time has now come that we will be taking the healthcare to the people. That is the promise of healthcare beyond hospitals, what I have been talking about. That is the promise of artificial intelligence, and that is the future we all must aim to build together. The future of healthcare will not be decided by the intelligence of our machines. It will be decided by the wisdom with which we use them, the compassion with which we serve, and the courage with which we ensure that no patient is left behind. The future of rural healthcare will not be determined by how many hospitals we build. The future of healthcare will be decided by how intelligently we extend healthcare beyond the four walls of these hospitals. That was my submission on how to transform the healthcare from a rural setup by modernizing it through artificial intelligence and making it reach to every single village, the last home, the last person in a rural and the remotest corner of this country. That's my vision, that's my plea. Thank you. Jai Hind.
Global Excellence in Healthcare Management and Strategic Leadership Award. Award goes to Wing Commander MK Bose, CEO, Amor Group Hospital. May I kindly request Wing Commander MK Bose to please come forward and receive this prestigious recognition for his outstanding leadership and contribution to healthcare management.